also, I think he's going to be explaining about one of the things that I found in the book was that one of the largest toxicities that we experience, do you know, sometimes we think it's like in the environment, the air, or the water we drink, or the ozone, or the sunlight. Do you know where the largest exposure to the toxicities that we're seeing actually is in our gut? And there is a there's a pathway between the gut and our brain. And what we eat actually affects how we think. And this is his specialty. He's been doing research, not only on it as a professor, but also as a medical doctor. And he's done research papers for 45 years on this subject, specifically dealing with patients with Alzheimer's. So we are very fortunate today to have Dr. Robert Friedland to be with us. He is coming from Europe. I forget which country in Europe. So he's about, I think, he's way beyond, before us right now in time zone. So he's going to speak for about 45 minutes. Then we're going to be joined with, I believe, by Dr. Sheila Patel from the Ayurvedic physician and MD at UCSD, who is also known to us as our Ayurvedic doctor. She'll join us in a discussion with Dr. Friedland about some of the things that he's sharing with us today. And afterwards, we're going to open it up to Q&A to both the Zoom audience and the audience here in San Diego. So, with this, I'd like to thank Dr. Friedland. You are on our big screen, Dr. Friedland, so we're sorry we can't have you here, but we see you projected on this big screen here. So we're happy to see you, and we're just delighted to have you speak about this subject. Dr. Friedland.
Thank you, Swami Harinamananda, very much. I'm pleased to talk to you and your group attendees about aging and some spiritual aspects of this. Can I assume you see my slide with the boat?
Yes. Yes.
Right. So, very good. As you've heard, I am a geriatric behavioral cognitive neurologist. This means I see patients which are mostly older persons with behavioral problems, and they often involve memory and judgment, cognition, perception, and other aspects of behavior. And in my years of practice, I've encountered many occasions where people have an incorrect or unhelpful concept of aging. In particular, they don't understand that what happens when you get older is because of what you do, how you act, how you eat, how you move, how you think. And I'm sure this is part of the spiritual tradition in many religious practices, that it's important to take care of our bodies. I put all of these ideas in this book, which was published in 2022, and I will talk about the 4 factors and what can be done. I thought it might help to define spirituality. I certainly couldn't come up with a perfect definition, but according to these definitions, spirituality involves a recognition of a feeling or a sense of that, the belief that there's something else greater than myself. And this has to do with deep religious feelings and beliefs, particularly a person's sense of peace, purpose, and connection to others, and beliefs about meaning. These things, of course, are very critical, important, and relevant to any consideration of aging. Most notably is the idea about the meaning of life, which is something which we all deal with, but it becomes particularly powerful when we get older. So just to reframe this question about our understanding of aging, think about these 2 cases. One is a 94-year-old man. He came to see me every year for several years, and each time he said, "I have Alzheimer's." And he said, I asked him why, and he said, well, I can't remember who wrote The Red and the Black. Actually, The Red and the Black is a rather old novel from France, and it's really not that important. So this fellow didn't understand that forgetting is a function of the brain, and we would all be really in big trouble if we didn't forget anything, because we'd have, our mind would be filled with irrelevant material, like who wrote The Red and the Black. Also, particularly, this fellow did not appreciate the fact that only 8% of men born 94 years ago are still alive. So rather than complain about what he thinks is a poor memory, he should celebrate the fact that unlike the 92% of the other people who were born when he was born, he's still alive, and he's here to complain about it. My second case is also quite remarkable to me. He rides a motorcycle and he doesn't wear a helmet. So why don't you wear a helmet? I said, why don't you wear a helmet? What's the matter? Why wouldn't you wear a helmet? He says, when you're going to go, you're going to go. So I said, well, when you cross the street, do you look both ways, or you just go because you want to cross the street? So why should you have to look? Because when you're going to go, you're going to go. And this sounds like a particularly relevant or likely approach for an uneducated person. But actually, I know many people who are professors and quite accomplished intellectual individuals who still feel that they're getting older and things are going to fall apart, and they might as well eat well. I mean, they might as well eat what they want, and they might as well drink too much and smoke. Because even though they wouldn't put it this way, they're acting as if they believed when you're going to go, you're going to go. And this kind of fatalism is really, really dangerous. So I will talk today about what we can all do to appreciate the miracle of our survival and the miracle of our most beneficial, most productive, and healthiest approach to aging. And all of this involves spirituality. In particular, the main three ideas here are attention, attitude, and opportunity. That is, what really matters is, what do we pay attention to? Do we pay attention to our relationships, our activities, our thoughts, or do we pay attention to social media or television? What is our attitude? Are we grateful for every day that we have to be alive, or do we think that the world is ending and there's nothing we can do about it? And finally, the important thing here is the realization that being older or having survived to greater ages is an opportunity which is not given to everyone. These are all key components of spirituality, as well as meditation. Meditation being really a practice of focusing attention and observing what might be a good or a bad attitude. My key points refer to these questions. Is aging inevitable? Does it happen to everyone? What are the three goals? And what does human evolution have to do with this? First of all, we don't want normal aging, because in normal aging, most people get high blood pressure. Many people don't have excellent or good health, very good health. And most people have more than 2 chronic medical conditions. So really what we want is not normal aging. We want exceptional aging. And there's things that we can all do to accomplish this, or to have the best chance of accomplishing this. So I will discuss what happens with aging and why it matters, and my theory of the multiple reserves, which explains what can be done and what determines how well we do when we get older. First of all, with aging, there is a decline in all body functions. This showing a decline from age 25 to 90 in kidney function, breathing capacity, nerve conduction, and cardiac output. So this looks rather dismal. However, what is remarkable is that although everything declines with aging, variability gets bigger. This means that young people are more like other young people than old people are like old people. So even though the function here on this graph of walking speed is declining with aging, there are many people up here, if you can see my arrow, many people up here who are walking just as well when they're 80 than they did when they were younger. This is variability, and it explains that the declines with aging do not happen to everyone. Some people do very well, and it matters what you do. The decline is not inevitable. This refers to, or is due to, homeostasis, which refers to all the processes responsible for managing the body. And when we get older, this balance of function becomes more delicate. This is not a disease, it's just a reality of aging. But it means that we need to be more careful about what we do, what we eat, and what activities we have, so that a fall off a horse at 20 is not as serious as a fall off a horse at 80. And the key word is interdependence, meaning the interdependence of our brain with all our organs and our interdependence of ourselves with others. And this is the key to fitness, that the brain is dependent upon the liver and the heart, and the way we do when we get older depends on how we get along with others and how we are active throughout life. It's widely believed, and I've asked now many people, including educated and non-educated people, is aging inevitable? And they generally say yes, aging is something that happens to everyone. However, only 86% of people born 65 years ago are still alive. So even with a relatively young age for older persons of 65, a lot of people don't make it. So I disagree with the idea that aging is inevitable, because many people don't live long enough to be old. Because it doesn't happen to everyone, that means it's an opportunity. Of course, there's Princess Diana, who died when she was 36. So what would she say if she was here and she heard that we said, oh, aging is inevitable, it happens to everyone? But it didn't happen. I mean, she did get older when she got to be 30 and 35 and 36, but she didn't get to be an old person. Everyone does not get to be old. And we're all one day older than we were yesterday, but we're not all one day older tomorrow than we are now, because we don't all survive over the night. And I think this is a very important spiritual idea, that our existence is a blessing. And aging is not the same as decline. It is not always accompanied by serious, significant decline. And we can do things to do better. An example of a 92-year-old who just wrote a book and won the Nobel Prize is Eric Kandel of Columbia University. So most 92-year-old people wouldn't be able to write a book, but it's possible to do that well. This is a reflection in part of the variability I talked about. I can propose these concepts in regard to three goals of aging. These are goals everyone should have, in my opinion. First, not dying. That's a reasonable goal, I'm sure. We want to be here. Number two, we want to be here and we don't want to be sick. We don't want to have disease. I think what should be there, number three, is something else, which is largely ignored. That is, we want to be fit. We want to have the highest possible cognitive, physical, psychological, and social reserve, which allows us to do well when we get older, when the balance of our body systems become more delicate, and when our organ function declines a little bit here, a little bit there. And our fitness will allow us to maintain higher levels of function. And spirituality is part of this fitness, as you will hear. Particularly, the absence of disease is not the same as the presence of health. Health is really something else. Fitness is something else, not only not being sick. Two people, let's say at the age of 80, may both be lucky enough to not have cancer or, let's say, or heart disease or kidney damage. But one may be much more fit than another, and these are important differences. Important part of this is the idea that we're not made by evolution to do well with aging because it doesn't help our children. This is a rather complex topic. I'm not saying that grandparents aren't important, but that a natural selection is based on having children and raising our children. And if we live to be 40 or 50, we've already done that, or we haven't done it, but it doesn't matter to the survival of our genes if we'd all died when we were 50. This means this is an explanation for why it's so important to be careful about what we do when we get to be older, because we're more sensitive to the effects of trauma and bad behavior, like eating too much salt or sugar and not exercising. So I've proposed 4 multiple reserve factors. They're all interdependent, and they all involve spirituality, in that cognitive function can be enhanced with meditation, as well as physical, psychological, and social factors. I will discuss some of these factors in a moment. They're all interdependent. The idea about the reserve capacity, or the multiple reserves, comes from the idea of military forces which are withheld to serve later. So the reserves are ready for activity and available to serve when they're needed. Similarly, our reserve capacity allows us to have resilient responses to challenges which occur. Excuse me. So I am sorry to say the story of someone I knew, father of someone I know, who was in India, and he needed a knee replacement on both sides. And it was advised that he did do it one at a time. He was 72 years old, but he wanted to get it over with. So against the advice of his son and his doctor, he had both knees replaced at the same time. Shortly after surgery, he developed pneumonia and he died. I would have told him, if I had the opportunity, which I didn't, that at his age, he is more sensitive to the stress and pain and negative effects of having a major operation, and he should do one at a time to give himself the best chance for survival, for doing well. Because his physical reserve capacity is lower because of his age. Cognitive reserve is enhanced by education, as well as cognitively stimulating activities at work and at home, and it helps to protect against cognitive impairment. This can be summarized as it's good to do things which involve learning. It's not the only thing about reserves. There is enormous literature about this, and certainly this is a good concept, but cognitive reserve is not the only activity. As the Swami said, the gut bacteria are our largest environmental exposure. On the left here, you see a sneeze showing that the droplets can stay in the air for 10 minutes. However, the gut bacteria are half or a full kilogram of living organisms, and they're with us at all times. All of our ancestors going back 1 billion years had bacteria in some way. And our bacteria evolved with us, and we evolved with them. So it's a very important relationship. And these organisms are dependent upon our diet. So if we eat poorly, we damage the bacterial populations, which can contribute to disease. For example, periodontitis, which is the most common oral infection, is a risk factor for heart disease and stroke, as well as Alzheimer's disease. These oral bacteria produce proteins that can cause bleeding in the brain. So everyone can help to maintain a healthy population of bacteria in the mouth by taking care of their teeth. And we evolved with them. The actions we have influence these organisms and impact their role. This occurs not only in the gut, but also in the mouth and the nose, which can influence the brain, which has a role in several diseases, including stroke, Alzheimer, and Parkinson's. Psychological reserve describes the ability to maintain healthy mental function and avoid agitation, anxiety, depression, etc. And meditation plays an important role here. The ability to focus on the present moment and not the past or the future is a key concept of this in spirituality, and to enhance psychological reserve, to have a ability to withstand stress and preserve mental balance when things happen when you get older. People who are emotionally more stable have more resilience and more conscientiousness. These people have resistance to impairment, even if you have Alzheimer's pathology developing in the brain. Mark Twain said, many people live their life suffering from tragedies that never occur. So certainly it's a concept of spirituality that we should be aware of what's happening and not worrying about things which have not happened, which won't happen. This may be particularly common now when we have such incredible communication. Every time there's a plane crashes in some small island in the Pacific, we'll know about it immediately. I'm not implying that we shouldn't know or that we shouldn't have this kind of communication, but we should realize that part of the global anxiety about the future is this excessive communication where we all know about every tragedy that ever happens. So a recommendation I have is it's wise not to watch the news at night before bed, because it's likely there'll be something horrible that happened. It's relatively unlikely that the news will say, we're glad to say that Israel and the Palestinians have reached a peace agreement. I hope that happens today, but I'm not expecting it. And Randolph Ness explained the concept that what good is feeling bad was the title of his paper. What good is feeling bad? The idea is depression is an evolutionarily adapted mental state. So it can be a sign that there's something that can be done. So perhaps meditation would help to realize why you have depression or why whatever mental phenomenon is going on. And knowing that it can be a sign not only that you need antidepressants, but that there's something to be done. Social reserve describes interpersonal networks and support systems and the ability to be connected to others. The risk of Alzheimer's doubles in persons with loneliness. And of course, social reserve is an important component of spirituality for every religious group. I think of the Buddhist belief that participants take refuge in the Sangha. They take refuge in the ability to be with others, which of course is a critical component of all religions. Particularly important for social and psychological reserve, as described by Viktor Frankl in his important book. The greatest task is to find meaning in his or her life. This is a very big issue in aging when many people have a spouse dies and they're not working. Either they can't work because of they're removed from their occupation because of age, or they can't physically continue in that work. And then they have children who move away or children who don't call. So the loss of meaning can lead to depression, which can lead to physical inactivity. Physical inactivity leads to depression. So it's a vicious cycle. So it's a task for all of us. And this is also a spiritual dimension, as I described earlier. It's a spiritual dimension to find meaning in what we do. And it's something it's a task which needs to be pursued at each stage of life. To think, well, okay, in 10 years from now, I will be retired. What will I be doing to find meaning? What could I do now to help prepare me for that situation? So the applications for these concepts for what people should do include spirituality, but also physical activity, cognitively stimulating activities, and so on. We can't divide the multiple reserve factors because of their interdependence. That is, they're all related to each other. And I should say it's recommended that all people discuss with their doctor any changes in lifestyle behaviors or supplements. But the beautiful thing here, I'm not proposing anything that could possibly be bad for you. The microbiota or the gut bacteria are our prisoners. They have to eat what we give them. And if we change our diet, we can improve our health through changing the bacteria. Particularly important here is fiber. It's a component of complex carbohydrates that you can't digest. This includes whole grains, fruit, vegetables, legumes, brown rice, and beans, but not meat. So if you have a hamburger, you are not feeding your gut bacteria what they need. And this is associated with inflammation, stroke, and heart disease. The best summary is to eat a plant-based, low-saturated fat diet with little sugar and salt and little meat. This doesn't mean you can't have salt and you can't have sugar, but that a enormous can of Coke or bottle of Coke has a toxic amount of sugar. Physical and mental exercise enhances the health of the brain and actually produces growth factors. And it has to be regular. It can't be something that you do only on special occasions. This Dr. Ness, who we heard about earlier, who co-founded this field of evolutionary medicine, and said that social media is like crack cocaine. We have social obesity. We can't stop our consumption of opportunities to display ourselves and get feedback from other people. So social media really is often a constant bombardment about all the wonderful things that happen to others. So why would I want to know that this friend of mine is now on a cruise in Italy? Well, I'm glad they're on a cruise, but if you have a habit of doing this all the time or being bombarded constantly, oh, look at this. Isn't it wonderful this happened to him? This is wonderful happening to these people. Don't post a note that they fell off the porch and broke their leg. So that spending hours a day reading about wonderful things happening to other people is not good for your mental health, particularly for children. Meditation helps with all of this. And of course, meditation is a key concept of spirituality. The Harvard psychologist of the 19th century said, William James, the greatest weapon against stress is our ability to choose one thought over another. Of course, this is a component of meditation as well. And there is evidence that meditation will help to control blood pressure and help with depression and so on. Also, I have good news that, did you know evolution has developed good mechanisms by which the brain can be protected from multiple blows? This is actually true. However, it applies only to woodpeckers. So humans do not have a way to protect the brain from injuries to the head. Woodpeckers can do it. It's a long story how they manage to, why they don't fall down but they can do it thousands of times a day, and they do very well. But chronic traumatic encephalopathy, or CTE, is found in over 90% of NFL professional football players. And head injuries are bad. The best statement about that is that small head injuries are bad and big head injuries are bad. They're both bad. Multiple head injuries are bad. So whatever we do, we should do whatever is necessary. Particularly, don't let your children play football. Now, a particularly painful aspect of this is all these factors are linked to poverty and racism. All disease conditions are more common in poor people. And in the current political climate in the United States, this is going to be even more poorly addressed than before. It's very hard to say something about this, in the context of this talk, but it's a great disaster for the health outcomes of the country, particularly that there's no interest in providing health care for the population in the United States. Now, what life periods are important? Of course, it's important for older people what they do, but actually it's for all ages, even in childhood. Education is very good for the brain. Head injuries are bad at all ages, including toxic exposures. And children should develop recreational activities which lead to lifelong patterns of physical activity. If they learn to play football, they will almost absolutely certainly have to stop that when they graduate high school. And hopefully one day we will make America smart again, but I'm not sure this is happening right now. So in conclusion, Because aging is not inevitable, it's an opportunity. We must work actively to enhance these 4 reserves throughout our life, to maintain resilience with aging and increase the chance to appreciate these opportunities. And spirituality has a critical role to play in all these 4 reserve factors to enhance the health of the brain, the ability to resist stress and to survive challenging life events, which happen to everyone. Also, the need to be physically active and to eat well. So I will conclude shortly with an example of this gentleman we know in Kyoto, Japan. We saw him in November planting seeds in the ground around this canal, which carries water from Osaka to Kyoto. It was built in the late 19th century. And every April or so in the spring, the sakura or cherry blossoms bloom all along the canal. It is magnificently beautiful. Maybe one of the most beautiful things I've ever seen anywhere. And we saw this fellow in November when there is no cherry blossoms, of course. He's planting things all along the side of the canal. We asked him, what are you doing? And he was with others. He's planting these yellow flowers, these plants that will grow to be yellow flowers. You see that here in this photograph. Because he thought that the yellow flowers would enhance the beauty of the cherry blossoms. And here is this, he's 92 years old. He's been doing this for many, many years. This activity of his has a cognitive component because he has to know where to plant it, how deep to go, what time of year to plant it. It has a physical component because it requires him kneeling on the ground and digging the soil. It has a social component because he's doing it with his neighbors and he's managing it with others. And of course, a psychological component, most notably, he's producing something beautiful for others. And of course, all of these are part of the spiritual component of this activity, which he has continued for so many years. And to conclude, I want us all to view aging as an opportunity which is not available to everyone. That led me to look up this word opportunity. And I didn't know this, but the opportunity comes from this word and this phrase in Latin, which means having a favorable wind coming to port. That's where the P-O-R-T in opportunity comes from. And I think it's a beautiful example, or maybe just a model for aging, because we would all like to have a favorable wind as we get older. Just imagine how hard it would be to get a boat to come to port 300 years ago when there were no motors in the boats. All you could depend upon was the wind. So I think if we think of aging as coming to port, we can realize that what we can do as individuals with our 4 reserves will help us safely come into port. And I'll be very grateful for the opportunity to answer your questions. Thank you very much.
So thank you, Dr. Friedland, for this wonderful presentation. So at this point, I'd like to bring in Dr. Sheila Patel into the conversation. Sheila, you
Hi.
can.
Namaste.
Can we pin like Sheila and Dr. Friedland also here as well? I think we can just give us 1 second to pin both you guys up there. Wonderful. Can you also pin me here? Third one, great. Okay. So Dr. Friedland, this is Dr. Sheila Patel. She is both a medical doctor and Ayurvedic physician She's also from she's one of the CEOs in the Chopra, Deepak Chopra Institute, and she's been the primary physician for the Chopra Institute. Thank you, Dr. Patel, for joining us. Thank you, Dr. Friedland. Dr. Friedland, I'd like to start off with the first question for you, is that you talked about having these 4 reserves: physical, psychological, social, and the mental reserves. All right, that seems to me for someone who is in a little bit of a younger phase, who can develop these reserves. What do you say to a patient like my father, for example, who's 87 years old and who has been diagnosed with Lewy body dementia? Or my mother, who's 83 years old and who has a chronic, what do you call this, osteoporosis. At this point, my dad want to ask you, what can he do at this point in his time? Is it too late for him? Does he have to describe that this is my karma, this is my fate? Or can you give him a proactive approach in facing this disease?
Yes, thank you. There are studies that show physical activity is helpful in Lewy body disease and Parkinson's. So there is, it will not cure the disease. It will not arrest the progression, but hopefully it will slow the progression and help him to retain function. There are even studies in Parkinson's of boxing. Sounded like a really horrible idea to me, but what they do is hit a bag, or in a boxing ring, I mean a boxing center, they don't hit each other, or nobody gets hit. So that's important right away. But they somehow, the very severe or intense physical activity of punching a bag has a good effect on the brain.
Yes.
And even walking is a good activity for older persons.
You also mentioned that in terms of, I remember in your book, it mentioned green tea. Is green tea something that can be helpful at this moment in time for him?
Yes, I recommend everybody drink 2 cups of green tea a day. And I'm sure Sheila will have something to say about green tea.
Is there anything else that you would prescribe for my father? You covered basically the physical component of it. What about the social or mental components of this?
Well, yes, it would help for him to be in a group with other patients with the same disease. He may find compatible people to commiserate with. That can be very helpful. And I would mention for your mother with osteoporosis, walking is helpful to enhance bone density. Also, diet is important.
Yes, that's a good question here. I wondered about this in terms of support group. There are what we call Lewy body dementia support group. But when I was posing this question to one of the social workers, that should he come into this group, she told me that, well, there are pros and cons. The cons is that you start to see patients who are much worse than you are. And then this can actually could be detrimental to see like what it could actually evolve into. And that may not be so heartening to you. So I understand. What would you recommend in these type of, to commiserate? Yes, but when you start seeing other people who are much more worse off, does it dishearten you in that sense?
Yes, so the leader of the group, or the person who arranges for these sessions, should be able to address this concern, and perhaps say that based on how severe your father is and based on the severity of the other members, perhaps it's not recommended, or perhaps it would be a good idea. And usually the participants' response is not so severely catastrophic as you might suspect.
Okay.
It's good for people to be aware even of the bad effects, what will happen in the future.
Thank you, Dr. Friedland. Dr. Patel, is there anything you'd like to engage here in?
Thank you. Nice to see everyone. And thank you, Dr. Friedland, for your talk. Lots of great information and such an important topic, right now. So I am a primary care physician, but I like to integrate the teachings of Ayurveda, which are very foundationally based on body, mind, spirit. So what you talked about, that they're interdependent and that we really need practices for all of those aspects of our life. So I think what a lot of the science is showing is very fitting complement and validation for what kind of has been talked about for thousands of years, but nice to see the science around it. Yeah. So thank you for that. I was curious. So one of the things I see, this is a question for you. I'm curious how you approach this, because and I'm sure you see families of people, they bring their parents in, or that have whatever neurological or cognitive issues, that now there's some newer ways, specifically for Alzheimer's, not maybe all types of dementias, for testing. And I'm curious to hear, like for the children, they're very concerned about developing, say, Alzheimer's. And of course, we talk about lifestyle and all of the things that you mentioned. What advice do you give them about, some of the newer testing that's out there, when it's appropriate, when not?
Yes, thank you. That's a really good question, and it's a big problem.
Yeah.
And what is hard for people to understand is the tests will tell the doctor what's happening in the brain, but they won't necessarily say anything about what's happening to the person's function.
Mm.
For example, my aunt died at 97. She was not demented, and her brain was filled with pathology of Alzheimer's disease.
Mm.
So a blood or a spinal fluid test would have shown that she had it, or a PET scan, but that wouldn't have said anything about her function. So if she had been tested when she was 80, it would have showed she had all this pathology. And then she would have worried about it for almost 20 years, and then she would have died without getting it. So that this is not widely understood. And tragically, a lot of these tests are done by companies that make money. The more people have the test, the more money they make. And these companies have consultants who are neurologists or other doctors who give them advice, who get paid frequently, 10, 20, 30, 40, or $100,000 to give them advice and to give talks all around the world about how important these tests are. And there are cases, let's say, if a 60-year-old patient has a problem, that the test might be helpful in a diagnosis. But for anybody 70 or older, it should be discussed clearly with the doctor, because having the change in the brain doesn't necessarily mean you will develop the impairment. And it's especially true about younger people. And
Right.
it's related also to genes, so that if you have it doesn't necessarily help to know if you have an Alzheimer risk gene.
Mm-hmm. Wonderful. Thank you for that. Yeah.
Can I jump in here, Dr. Friedland? Is that you mentioned about genes, and in your book you talked about that the genes we have sort of correspond to our hunter-gatherer days, and that now we are living in different times. Our genes have not adapted to the lifestyle that we are living now.
That's right.
Can you explain a little bit more about what you mean by that and what is happening now? Talk a little bit about how genes, you talked about the genes and the relationship to the environment. Do they become activated in certain stimuli, certain environments? And then what's the lifestyle now that we're doing that is not in favoring what the genes were supposed to do?
Yes, so very good, thank you. For all of human history, everybody was physically active, because if you weren't physically active, you didn't have any water, you didn't have anything to eat. Our ancestors didn't have refrigerators. They didn't even have any way to preserve food until maybe the last 10,000 years. So from 100,000 to 10,000 years ago, everybody had to go out and eat and get their own food and take care of their own lodging. And it required an enormous amount of energy. And nobody was physically inactive. So it's not, we don't have genes which allow us to maintain a lifetime of physical inactivity. Also, if you wanted to have a lot of sugar, the only thing you could do is attack a bee's nest. But they didn't, you know, the chocolate was going to come much later. So that we're not protected against high levels of salt or high levels of sugar in the diet.
Thank you. Dr. Patel?
Yeah, I was just curious, another question that came to my mind is, as you mentioned, this interdependence, you know, and I usually do, again, talk to people about like physical practices, as you mentioned, the cognitive practices, you know, people will readily adopt in many cases. And then spiritual components, I think, because there's more awareness, you know, of community, and many cultures and groups, you know, community is built in, not for everybody, but it's that emotional piece that I think people struggle with the most. I was curious if you had any tips or tricks about addressing that. You know, we see people that can sometimes skip that part of it, you know, where they maybe are holding on to resentments, for example, angry, you know, and when you start to talk about, you know, dealing with emotions, of course, it's, you know, people want to skip to some of the other things. And how important, you know, do you have tips, and how important do you think, you know, addressing that part of it is? Because I see it a lot.
Well, I'm not sure this is the right response to completely, but I think regarding emotions, the important thing is to deal with it, not hide it or bury it. So unfortunately, when I was growing up, one of the main teachings or mottos of my family was, if you don't have anything good to say, don't say it. Which in retrospect, it's really toxic.
Right.
And the other suggestion I have is that silence is very meaningful and is helpful in dealing with emotions, if that's possible.
Yeah, so you essentially, what I'm hearing is you just explain to people how important it is and encourage them to express in healthy ways. And then, you know, again, like all the practices, they may or may not do them, but
Right.
yeah.
Confront it.
Yeah.
And experience it.
Yeah.
But don't bury it.
Right.
Dr. Friedland, I think in either in a talk or book, you suggested about, can you explain what an emotion does? You talked about how it creates a pathway, and that this is something that you can't get rid of, this sort of neurological pathway. So I thought the idea was you just learn to cope with it, not shut it down, not get rid of it. But from a Vedantic point of view, we try to expand the space, our inner space within us, to make room for it, not to navigate to it. We can coexist with these difficult emotions. Is that what you're implying?
Yeah, certainly. If you're able to absorb the emotion and understand it and experience it, and not bury it or ignore it or deny it. And of course, meditation can help with that. And an example I have for myself, I'm not sure this is perfect in regard to emotion, but anxiety is almost always about the past or the future. If you're going to the dentist and he approaches you with a big needle, then okay, at that moment you could be anxious. But most of the time, we're worried about something that happened, or we're worried about something that might happen or might not happen. But we're not actually anxious about the moment. So that if you just focus on the present moment and not on the past and not on the future, that can relieve anxiety. And I guess anxiety is one form of an emotion.
Thank you. Any more questions, Dr. Patel?
I don't know if you want to, I see there's a hand up, so maybe I'll
Right,
defer.
so at this point then, I'd like to, in the audience or on Zoom, if you're in Zoom and you'd like to ask a question, just raise your hand. And does anybody in the audience here have a question for Dr. Friedland or Dr. Chopra? Okay, so let's go then with the Zoom. Let's see here. Yeah. So who's the person? Lolly, go ahead and unmute yourself. Lolly, go ahead and unmute yourself.
Okay. Thank you, Swami Harnamananda. Thank you, Dr. Friedman and Dr. Sheila Patel. So I know we hear about, the blue zone effect, and they're doing a lot of research and stuff like that. So even for people who have, advanced with dementia, Alzheimer's, it does make a difference then to engage with different age groups as one, and does it help for them to be volunteering with children? Does that help them?
Yes, certainly. That's a wonderful idea. And it has been implemented in some places, particularly in Cleveland at University Hospital. Dr. Peter Whitehouse has an intergenerational school. And I think it is good for children to be in contact with older persons. It's good for older persons for them, and it's good for both. And it is a rather difficult thing to accomplish because of the economic problems with education. But certainly, I think it's a wonderful idea.
Thank you.
Dr. Patel, do you have anything?
Yeah, I think it's a good point, because I think, and what I teach a lot of is like kind of reconnecting back to like more natural way of living in many ways, right? Like being in sync, circadian rhythms, and how we heal better, but also this sort of social aspect. I think culturally it was built in, right? There were grandkids and grandparents and, parent, like kind of all coexisting, whether in the same location or at least close by each other. So there was just this natural way of doing all of these things that now we have to work a little bit harder to implement, as people are like living separately. And I think, there's just a lot of challenges in all of these aspects of these reserves, as Dr. Friedland mentioned, even not too long ago, that it was easier to walk to the store or walk to places. And now we sit at home, maybe walk a few steps to a car, drive where we're sitting, and so those are challenges to the physical activity, and then emotionally and socially as well. So I think we just have to try to think back and go back to, some of these things that were already inherent and built into the way people lived. But it's a challenge. I mean, I don't sugarcoat it, so to speak. A lot of these things are just challenging, and we do the best we can. But I'm encouraged that there's more and more emphasis being placed on the interdependence, as Dr. Friedland mentioned, about physical, mental, and emotional and spiritual components. So, because I do see a lot of people who focus just on food or activity, but they forget about these emotional and spiritual aspects to health. So, I think, again, just have to work a little bit harder to implement these things. Yeah.
Dr. Patel, because you're from an Ayurvedic background, so there's the 4 reserves you talked about. Is there anything else you would add from Ayurvedic standpoint that you mentioned, like say you mentioned circadian rhythms, or you were talking about I know Dr. Friedland has talked about like legumes, diet, and really the diversity of food. anything, this is also, I see its correspondence with Ayurveda, but in Ayurveda, is there any other thing that sort of is missing or you would add into that model that you've heard?
I think the model, is again, like science is really just confirming these old models, body, their physical practices that does include food and movement, mental space, like learning and, emotional regulation, and then this kind of spiritual component, meaning, purpose, connection to others that, but I think what Ayurveda offers is when what I end up teaching people is just so many practices for all of those, like daily practices. And I think you may have mentioned, Dr. Friedland, or in one of the slides, like these are things that we need to do regularly, right? So like one of the things then is taking it to the next step of, okay, how do I address all of these pillars? Well, there are daily practices and there's a daily routine where you do things on a daily basis that will sustain the benefits, rather than just kind of doing it when you're not feeling well. And so, I find a lot of benefit to just teaching people small little practices they can do throughout, but every day, right? Including meditation, but even things like, and I'm sure Dr. Friedland, speaks to this as well. Like, you could see food, yes, but also all the senses. So there's a whole aspect to 5-sense therapy, and there's some research and data on how important it is to have the proper sensory input to, kind of develop that neuroplasticity and brain connections. And so in Ayurveda, there's a lot to be said about, sensory practices, sensory input. So, yeah, I just look for all, these little practices that people can do on a daily basis to, optimize. And then, we teach breathing a lot, that, pranayama and, breathing is kind of the bridge between the mind and the body, that can really help. Yeah, so. But
Dr. Friedland, any other practices come to your mind that you found very helpful with the patients you served?
Well, I often would tell my patients and families, that you don't have to put sugar on cereal. You can put raisin.
yeah,
Raisins have sweetness, and they also have fiber. And they have less sugar than sugar itself, of course. Also, that one component of an eating experience, which is often or usually ignored, is hunger. If you're hungry, everything will taste better. And nowadays, we all have food available to us all the time. So we can have breakfast and then a snack, and then lunch and then 2 snacks, then dinner, and then a few more snacks. So there's no time during the day if you practically never get hungry. And I think hunger is probably, it certainly enhances the appreciation of food.
Is there a role for fasting? Is fasting beneficial as a way of cleansing our body, do you find? Or explain a little bit about that.
I really don't know. There is a mixed literature supporting intermittent fasting, which means you might not eat for 12 hours or more, or 14 hours a day, not eating, and then you have breakfast, and you might have lunch and dinner, but no breakfast, and you're not eating, of course, when you're sleeping. But there's mixed literature about that, so I'm not able to make it's something to consider, but it's not clear that it's good for you. I wonder what Sheila thinks about that.
Sheila,
yeah, I agree. And I think part of the reason we see a lot of mixed data, like there's some things that are agreed upon, this is likely beneficial for everyone. But one of the things I appreciate about the Ayurvedic medicine is this concept of different mind-body types. And, I've presented to that effect to this group in different other classes. And so I think that's why we see these mixed results all the time, because when you can identify for which person this practice would be best, and not so, in fact, it might be the opposite of good for another mind-body type, these doshas, like that's kind of built into the Ayurvedic medicine system. And so I sometimes think about that as I'm recommending things to people, whether I think this would be good for this particular person, because and so it's an interesting point, because I think that's why there's a lot of confusion and the way, you know, science is done for populations of people. Sometimes there are mixed results because there, you know, there's no one size fits all. So yes, yeah.
I think I remember Dr. Friedland mentioned that he does not like the idea of personalized medicine. I think you said that all medicine should be personalized. Right, that each patient
Yeah,
is
so
unique.
Yeah.
personalized medicine was described by the head of NIH, but it was supposed to mean you choose what to do with the patient based on their genetics.
Oh, I see.
And I think that's a good idea. I'm not opposed to that, but it shouldn't be called personalized, because every patient should receive personalized treatment, personalized care. We can't do the same thing with each.
Right.
But can I be honest with you, Dr. Friedland? I work as a chaplain in a hospital there. One of the biggest complaints we get with patients is that physicians nowadays don't have a lot of time to spend with the patients. They feel like it's like a sort of like a cattle herd. You sort of rushed in and rushed out. Do you have any views about this? What the medicine should look like, or what do you foresee in the future for better care?
That's a critical problem, and I discuss this in my second book, which is 100 Lessons in Critical Thinking, which was published about a month ago. But we have to demand care. We have to demand the presence of the doctor. And if you go to see the doctor and he never looks at you, or she never looks at you, but is busy with their computer while you're in the background, then you need to find the doctor.
Yeah.
So we
It's
have
not
to
easy.
advocate for ourselves.
We have to be our own spokesperson. We have to be aggressive.
And to be honest with you, I noticed that with aging population, like aging parents, they tend to be unseen by the medical. So unless you have someone advocating for them, they sort of get left sort of outside, and their needs don't get taken care of. So anyways, I'm just throwing that out there. But yeah, I agree with you. We have a question from Indranil. Indranil, would you like to unmute yourself?
Yes, thank you so much, Swamiji, and thank you so much, Dr. Friedland, thank you for the wonderful talk. You mentioned Viktor Frankl's book and the importance of finding meaning. And I think, if I remember in the book, he mentions that in some way, suffering ceases to be a suffering when someone finds meaning in their condition. So I was thinking, how or what can possibly be said or done to a person with dementia or Alzheimer's, so that they can find some meaning in their condition.
So thank you. This is a difficult problem, and I did have one patient who was an older, maybe 85-year-old woman from Italy, and she was quite demented, and her son had a restaurant, and I went to visit him, in a very successful restaurant. Maybe there were 50 people in the restaurant at any time. And at a table right in the front of the restaurant was this old woman, and she was folding napkins. She would say hello to all the help, all the waitresses, waiters. They would all walk by, and she had a glass of tea there, and she was helping her son by folding the napkins. Of course, this was only a certain period of time before she got more impaired and she couldn't do it. But at least at that time, she played a meaningful role in the family's life. And it's not always possible to do that, but at least it should be pursued. So, for example, if the doctor finds out that the patient used to play the piano, well, playing the piano is physical and social and is a good thing for everybody. And that can be recommended if there's a piano available and the patient at one time had an interest in it. So this does require inquiring and learning about the patient and learning about the family. And that takes time. And the healthcare system, our health economy, is not set up for that. But there are occasionally of course, doctors who are more aggressive and able to provide care in this way, if you can find them.
Thank you so much. It's a wonderful answer.
I wonder, Dr. Friedland, if at all you think that at some point is the spiritual practice maybe just to surrender. There's a lot of fighting when you get irritated about, like, you can't remember things, you can't do this, you can't. So there's this, what we call grieving about the way we used to be. And there's this kind of like, I want to get back to who I was. And to me, it seems like, wouldn't it be easier, I know this is going to be like sort of, but to let go of who you were and sort of like allow yourself to be who you are and just surrender to this what is.
That's exactly right. And aspects of that, for me, would include the idea that, okay, I may be unhappy with how poorly I play tennis, or pain in my knee, or the times I come home from tennis, I can't decide to put the ice on my knee, my shoulder, my wrist, or my foot. But how about my friend in New York who died of Alzheimer's disease, who was a neurologist just like me, an Alzheimer's specialist at Stony Brook? I mean, he got this horrible disease and he died. I went to see him several times, but how trivial my problems are, so trivial in regard to his. Also, many people will be suffering and will think, why me? Why me? Why me? And there's a story about a 94-year-old person admitted to a nursing home who said, why me? Why me? Well, she's pretty lucky to have survived and had an independent life until that age. A better question is, why not? Why not me? I mean, if you smoke, then maybe you shouldn't ask the question, why me, if you get lung cancer. But for most other conditions, there's no answer to the question, why me? But the equivalently important, maybe more important question is, why not?
Sheila, any insights into this?
Yeah, no, I think it speaks to, what he mentioned with attitude, right? And so sometimes we can help either with our relatives or as a physician. Sometimes what I do is, try, because people come in and we do want to listen. There's a lot of complaints, right? As you get older, they have this and that and pains. And so you listen, and then sometimes I'll ask them, like, can you name 3 things you're grateful for? Like, or did, 3 good things that happened today or something like that. And then I'll encourage them, like, oh, maybe, every day just write something down, something good that happened. It can be something very small. It can be something big that you're grateful for. And then, put it in a jar or something. And then, sometimes when you're not feeling well, you can, look at all the things in the jar and reread, some of the things. So, again, and that's, as he had mentioned, this kind of shift in attitude, because it is easy to get down, right, when things aren't going well. So I think we have to more actively pursue practices that help us shift that attitude, and again, whether people do it or not, I don't know, but at least we can recommend, these things. Yeah.
I'd be curious, Dr. Friedman, in your experience, what have you felt about legacy? So legacy here, I'm talking about as we start to decline, there's a sense of like, we want to feel that there's a continuance of our own identity. So, from the Vedantic level, we believe, that Eckhart Tolle says that the opposite of death is not life, but it's birth. Because we're going to continue to exist, whether we're embodied or we become disembodied. There's still a continuance of existence. That's why there's the Vedantic feeling that I shall never not cease to exist. You can never think of a time that you will not be there. The body made it, but your consciousness, your awareness will continue. You can't think that I'll cease not to exist. But what I see though is that sometimes patients want to create a legacy about a continuation of that, something that I've done in my life to be memorialized, to be remembered by. How important is that when patients are getting older? Is that something you find that we should try to do or offer?
I think it's narcissistic to be concerned about how you will be remembered. I think it's better to do good things and to be kind and to show a respect for life universally and do what's recommended and not worry about how people are going to remember you, because that's not that important.
Yeah, agreed. I think, even in the Vedantic sense, like that's really in an attachment to ego, like what I did, in this life. And so, when you identify more and more with awareness and consciousness and, in Vedanta, like, Brahman, those other things become less and less important. And, yeah, it's more of an attachment, right? that we need to let go of.
Yes. All right, we're gonna have one more question and then we'll wrap it up here. So Lolly, go ahead and ask your final question here.
I was just thinking, one thing that I noticed with my mother-in-law was she's starting with dementia, but then when we went, and if I was smiling at her all the time and talking to her, then she related with me. But the minute somebody walked in and asked her a specific question, do you remember who this is? She just froze. And after that, everything she'd say, I don't know. So maybe for us as, because we are dealing with older people, does it make sense to just do that? And every conversation with my parents, I always ended with, God is great. So, and I would wait for them to say that back to me if it happened, every conversation. So I'm just wondering if these simple things, something that we can do for them from over many years, whether or not they respond, helps maybe to be cheerful around them?
Absolutely. You do whatever you can to help them to be happy at that moment, even if it involves lying. If they ask you, let's say their husband had died 10 years ago and they've forgotten that, and they ask about him, at one point you might remind them that he died, but if they can't keep hold of that fact, you don't need to convince them, like show them the obituary or the just say, yes, wasn't he a wonderful person, or isn't he a wonderful, even so there is a group in Holland that actually created a false bus stop for people who wanted to go home. They would say, I want to go home. And they say, okay, let's wait for the bus. And there was no bus, and the bus never came. And supposedly the patients were tired waiting for the bus. They went back inside and they stopped asking to go home. I don't know if this will always work, but at least it's okay to manipulate the truth if it will be good for the patient.
Thank you.
One final question I want to ask you guys is that when the patient is in a sort of a unconscious state, or in the ICU, you'll see patients, who are in an unconscious state. Can they still hear you? Is it important to still talk to the patients even though they are not conscious?
Yes, that there are many cases have been reported of patients who woke up and were very upset because they were there when some doctor came by and said a nasty comment about the patient's nose or about them being fat or something, or regardless of. So you can't take it for granted that a person is not present if they're unconscious. So you need to be very, very careful and no matter what the cause of unconsciousness is. You don't want to be discussing other patients or talking about their physical features or insulting their religion or whatever it is. You just assume that they can, that they're there.
Last thing, have you heard any interesting stories about near-death experiences that you heard from any Sheila or Dr. Friedland from patients?
Yeah.
I as a neurologist, I can understand how, in an extreme severe state of brain dysfunction, one can have all sorts of hallucinations and delusions. And if the brain is not working, there'll be no hallucinations or delusions. So if someone has a heart attack and then they say, well, I thought I was dead and I saw a tunnel, I saw a light at the end of the tunnel, I saw my grandfather, and then I'm not sure this is end of life experience. It's just a hallucination or a delusion. But this is my rather materialistic view.
Sheila, were you going to say something?
Yeah, I mean, again, there's obviously different.
I believe in near-death experiences, first of all. I believe in near-death experiences. I've had multiple patients tell me about that. So there's some reality I sense that's there. Sheila, I wanted to hear from you.
Yeah. I mean, as I was going to say, I mean, obviously there are other varying viewpoints on what that experience is. I think in the model of like Vedanta, say, or other metaphysical understandings of what life is, that, and my work at Chopra too involved like a lot of people with these stories, because they tended to migrate toward philosophies where it helped them explain the experience beyond just like a material perspective. So yeah, I have heard many stories, and again, the sensory input, as you talked about before, definitely many people, can remember certain things that were said. And so I always, and one of the things that people would ask, because I teach meditation and we have meditation teachers that we train, is they would ask, like, how do you teach somebody with, like if they're in the hospital or with dementia meditation? It's very challenging, right? So I would tell them, just be in the room with them, because you create this sort of biofield, sort of a shift in the energy, and they can meditate in the room and it benefits the person, that's in the ICU bed or what have you, or passing and, transitioning, or, and we have mantra that we play, and like all of these different things, that there is some sense, even, during these transitions. And then again, because in certain philosophies and metaphysical paradigms, there is this concept of other lokas, other universes, other states of awareness that can fit into what people experienced in these, what we call near-death experiences. But yeah, I've met many people in this world of woo-woo that, tend to, again, migrate. But I do believe as well that, based on this Vedantic philosophy, and that they're just really entering other realms of consciousness and experience, that then, then they have to find a way to integrate that back into life, so yeah.
All right, well, I think we're at 12:30 right now, so we're going to have to wrap this up here. So I want to thank, first of all, Dr. Friedland, thank you so much for the great presentation.
Thank you.
Again, if you want more information about what Dr. Friedland talked about today, he has the book on aging, which is out, which you can purchase on Amazon, anything like that. And I'd like to thank Dr. Sheila Patel. In fact, 3 weeks from today, yes, we're going to have another session on Vedanta for elder care, and it's going to be spiritual practices and lifestyle choices for immortality. Spiritual practices and lifestyle choices for immortality. And in addition to joining Dr. Sheila Patel, will be Swami Satyamayinandaji on this talk. It will be 3 weeks from today. So again, I want to thank everyone for the questions, and thank you all for the scripts. Dr. Fried, where are you? I'm sorry, what country are you in right now?
Luxembourg.
Luxembourg. Okay. So you're probably way ahead of our time zone. Thank you so much for just being present with us today and giving us this fabulous presentation.
Thank you, Swami. It was my honor.
Thank you. And just for our general, for our audience here, next week is Swami Dhyana Yogananda, and he will be speaking here next Saturday, Swami Dhyana Yogananda. All right, we'll close up with the chant. Om Shanti 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 Hari Om Tat Sat Shri Ramakrishna Arpanamastu.